Hello everyone, I'm Dr. Varun and today we are going to discuss a very interesting article, Lifestyle Modification Program for Secondary Prevention of Atrial Fibrillation Patients. Okay, so normally our thinking goes that atrial fibrillation may be a contraindication for cardiac rehabilitation program or exercise prescription or a lifestyle modification program. But in this study, they have included or they have studied nine atrial fibrillation patients after 12 weeks of cardiac rehabilitations, and the results have been very promising. So let's go through it. Okay, so this article have been published in a reputed journal, that is Journal of Cardiac Rehabilitation and Prevention. So, and it has been recently published in the month of March issue. So let's see what the article says. So, atrial fibrillation is one of the most common cardiac arrhythmia, and it is associated with the five-fold increase in the risk of stroke. And the lifestyle modification may be promising in these conditions. Now, lifestyle modification programs such as cardiac rehabilitation can be useful and can be used to reduce the progression of the symptoms. And also, the American Heart Association has also identified that lifestyle modification in atrial fibrillation is an important therapeutic avenue. So, despite of all these recommendations, there is still lack of attendance or referral of such patients in cardiac rehabilitation program. So in this study, they have examined the feasibility and acceptability by the patients and the preliminary effectiveness of exercise and nutrition based cardiac rehab lifestyle behavioral program for patients with symptomatic atrial fibrillation. So they have recruited symptomatic atrial fibrillation. So what was the method? They have recruited overweight, obese individual. That is what is BMI is more than 28 kgs per meter square. Okay, adults of age more than 30 years and with symptomatic paroxysmal atrial fibrillation seen. Okay, now what intervention was given? So it was a 12-week intervention, and there was a cardiac life support group program, okay, modeled from the cardiac rehabilitation, which included six virtual and six in-person visits. And in that 12-week program, 1 hour group discussion, didactic education, patient education, which I always say is very important, about the nutrition, exercise, and behavior modification, which was led by the physician and dietitian. So, in person visits also included 1 hour supervised aerobic exercise and strength training. Okay, so in this six in-person visits, there were 1 hour supervised aerobic and strength training was also given to the participants. Now, what was the outcome measures they have taken? So they have studied the feasibility and acceptability. The feasibility was studied by the expressed interest of the by the patients of in participating in the program. The patient who completed the program and the study visits complete, that is 12 visits which was completed or not. Acceptability was assessed by a survey following completion of the program. Okay, secondary outcomes were BMI, atrial fibrillation burden symptoms, and quality of life. Okay, so atrial fibrillation burden symptoms were assessed during using atrial fibrillation severity scale, and quality of life was using atrial fibrillation quality of life questionnaire. So these were the primary and the secondary outcome measures. So let's see what were the results. So if you see, the burden of the symptoms were reduced meagerly by only one unit change, 1.2 unit change, whereas the symptoms were reduced by 4.6. So there is good amount of change in the symptoms. And if you look into the overall quality of life, which was, if you can see, higher the scores indicate higher increased quality of life. So it has gone overall from 68, the score has gone from 68 to 86. Okay, symptoms that is from 85 to 92, daily activity from 60 to 84, treatment from 67 to 85. So overall, the quality of life has been improved in these patients. So that means the lifestyle modification or the cardiac rehabilitation based lifestyle modification have proved to be very useful in these patients who were participated in this study. So all patients indicate that they found program helpful overall. All reported making diet and exercise changes, and most thought that they could maintain the changes and diet, that is 89%, and exercise 77%. Patient indicates that reviewing programs, notes, handouts, periodic check-ins, and program staff and logging diet and exercise daily would help to maintain their lifestyle changes. So let's see what they have concluded. So, this study demonstrated that enrolling the patients who were overweight or obese with symptomatic atrial fibrillation in cardiac lifestyle modification program for secondary prevention of atrial fibrillation is both acceptable to the patients and feasible. The next step they recommend is there should be an adequately powered pragmatic. That means there should be big randomized control trial should be there on this kind of patients to prove better feasibility or the better effectiveness of the cardiac rehabilitation program on atrial fibrillation patient. So for more recent articles and more interesting topics, please follow me. Thank you.